Sorry, I've been having a really busy day. Let's talk about your results, shall we, today, Mary? Okay.
Oh, hi, sorry, I wasn't realised that we were discussing results.
Yeah, you had a CT scan before. Unfortunately, it's shown a large lesion in the left breast. It's about 18 by 20 millimetres. We need to get some more investigations, though, and potentially along the line we may need to do a lumpectomy or maybe a wide local breast excision.
Sorry, what's a lesion?
It's a mass in the breast. It could be cancerous, so that's why we might need to do these further investigations and maybe look at removing the mass, and then potentially if it's spread anywhere else we can look at either radiotherapy or chemotherapy.
Sorry, do I have breast cancer? Chemotherapy, that's not good news. My friend had terrible side effects after having that and she couldn't finish the course.
Oh, sorry, this is really important. What we'll do is we'll meet in the breast clinic next week and I can answer any questions you've got there.
But when's the clinic? How will I know?
What I'll do is I'm going to send a nurse in and she can explain when the clinic is and what time it'll be, okay? See you next week.
Bye.
Hi, my name's Mr. Thorndyke, I'm one of the breast surgeons, but you can call me Ross. Can I just ask for your full name?
Mary Smith.
Is it okay if I call you Mary today?
Yeah.
Okay, and who have you brought with you today?
My friend Sue.
Okay. And do you know why you're here today?
Yes, for results of the scan.
Okay, and do you know what led to you having the scan in the first place?
Well, I noticed a lump in my left breast and it's slowly grown over the last 6 months. There's also a dimple just above the breast. Oh, and I've lost a stone in weight over the last 6 months. I went to my GP who examined me and he referred me for a CAT scan that I had a few days ago. Then I received a call telling me to come in to discuss the results.
Okay, and do you know why he requested the CAT scan?
He said that he wanted to rule out anything serious.
And do you know what that mean? What he meant by serious?
Cancer?
Okay. And would you like to know the results today?
Yes.
Okay. Is it okay if I talk about the results in front of Sue?
Yeah.
So unfortunately, the results aren't as we hoped.
Oh.
So the scan has shown what looks like a lump in the left breast.
Right.
So it looks like we might need to get some further investigations for that.
Okay. Do I have breast cancer?
It's quite early stages at the moment, but the fact that we found a lump in the breast means we do have to take it to the next step.
So, what happens next?
In the next couple of weeks, we'll do some more investigations, potentially take a sample of the lump and see whether it is anything sinister and whether we need to do any further treatment.
Do I need chemotherapy? How long have I got?
It's hard to say at the moment because all we've found is there is a lump. Once we've got the investigations and we've had a look at the sample, we can then discuss whether we need to do any further treatment.
Okay, so when will these investigations take place?
So hopefully in the next 1 to 2 weeks, we'll get you booked in for these further tests and samples, and I'm going to have a nurse come in, and I can see you're upset at the moment. Would you like me to get a box of tissue at all? Or?
No, it's okay. No one has had breast cancer in the family. Why me?
Sometimes the genetics do play a factor, but sometimes there can be other factors that can lead to breast cancer.
Okay. So when will the appointment be?
Well, after you've seen me, there'll be a nurse that comes in with a leaflet about what happens next, and she'll discuss when's the best time to book you in to see me in the clinic.
Okay.
Would you like me to summarise what we've discussed today?
Yes, please.
Okay. So the scan that we requested after the GP examined you did find a lump on the left breast. It's hard to know whether it is serious at the moment, but we will need to do further investigations over the next couple of weeks to find out whether it is something sinister. If it is something sinister like cancer, then we'll talk about some treatment options.
Okay.
Would you be able to summarise what we've discussed?
You found a lump, it might be cancer, and you need to do some more investigations.
Okay. And have you got any questions for me at the moment?
No.
Don't hesitate to contact my secretary if you've got any questions whatsoever. We're going to let you just take your time in this room for 10 to 15 minutes and then the nurse will come in. And if you've got any questions, you can ask the nurse then, and she can discuss if there's any questions she can't answer, she'll come back to me.
Okay.
Okay.
Thank you.
I'll see you in the next couple of weeks, Mary. Okay?
Okay.